So to continue, I was talking about the uh, public health model of etiology of addiction and the combination of the host, the user, the agent, the drug, and the environment, and how those can coalesce into a unholy trinity that can lead to substance problems. Empathy and active listening was discussed, and you've encountered this, many of you, in clinical skills courses in your own work. And the idea of empathy causes us to circle back to this notion of not judging the substance user as having engaged in something immoral or wrong, something they could have prevented, and not judging them in that way. And that certainly would assist in fostering empathy for the client, which is key with this particular population. And that leads into the active listening. A range of treatment modalities have been presented in this course, in the book, and the DVD, and the efforts of folks in the field to try and effectively match clients to the proper treatment. Brief therapies were brought up, not new to many of you, but perhaps some of you who might have known about, been familiar with brief therapies in the past, but did not necessarily subscribe to them, may now see the value of them and their effectiveness in engaging the otherwise resistant client. Pharmacotherapy and replacement therapy, two key growing components in the addictions field. As many of you have pointed out, it's of course important and essential that talk therapy continue to be part of the treatment approach along with medication, but that medication can very effectively stabilize the addicted individual and allow for the talk therapy and allow for them to engage in other domains of their life that have sort of disintegrated: work, family, etc. The harm reduction movement is talked about in several ways here in this course. We talked about the replacement therapy that I just mentioned, needle exchange programs, moderate drinking. All of these are efforts to lessen the risk at which the user is placing themselves or is placed. And it is difficult for some in the field, certainly in the general public, to accept the notion that we would be okay with a lower level of substance use, or actually providing, for example, a heroin addict with clean needles, not appreciating the way in which this lessens disease, the transmission of disease, and allows for engagement of the individual in therapy. Contingency management, another aspect of this: paying for clean urines, providing food vouchers or bus vouchers for people attending sessions. And that recent article I posted in announcements about paying addicts for vaccinations for the prevention of hepatitis. Mutual help groups. Many of you went to mutual help group meetings for one of your assignments, and I believe that it's pretty widely accepted amongst all of you that there's great value in mutual help and self-help, 12-step, AA, SMART, whatever it may be, as an adjunct to treatment. Mutual help groups are not treatment, but they're a very effective adjunct. Toward the end here, we talked about resistance as possibly being a problem of the counselor, of the therapist, and not a indication of the patient's denial of a problem or just not wanting to be in therapy. And so it becomes then the task of the therapist to modify and to switch gears a bit, switch directions, to sort of roll with that resistance and get to the best place for that client in therapy. And lastly, the notion of spirituality, not religion or religiosity, but spirituality, which can be found in a number of ways in organized religion, in Eastern religions, in meditation, in walking in the mountains, or whatever it might be, allowing someone to more easily look inside themselves and see who they are, what they're doing, what they want to do, what they want to accomplish. And again, this serves as an adjunct to therapy. It adds as an introduction to therapy for some folks, and can be an important part of addiction treatment. So all of those points and the points I made in the previous video here kind of highlight some of the things I think are more important. Things I didn't mention are not unimportant, but just wanted to highlight a few things for you. All right, take care. Thanks.